This is Pat Solver. I'm the CEO of Health Tech Hatch and the moderator of the Personal Connected Health Alliance's Innovation HealthJam. And you might be saying, well, what's a jam? Well, a jam is a global online brainstorming session, kind of a virtual conversation. And the focus of our jam is going to be how to create a digital health agenda to transform healthcare.
For us, mobile has really, started to become the main point of traffic. So back in 2010, we had about 10% of our traffic coming through mobile, and now we're over 50%. So people are starting to really utilize, this for their means of convenience, and we're very happy because it's a very easy way to reach out to folks for both, making it easier to fill your prescriptions clearly, that increases adherence, making that easier, but also other types of medical and health services that we offer, and so things like our healthcare clinics being able to go into a retail center very quickly, other types of programs. We have hospital readmission reduction type programs, and they're all really, they all could be aided with digital. And when we released the refill by scan technology, so you could actually scan your bottle, we saw a tremendous uplift in adherence amongst our folks, which we know is both great on our side clearly, but also on the outcomes. And I'm from a health plan background, so it's really all kind of comes down to that outcomes and how can you really kind of move the needle. And we want to make things convenient for we all know healthcare is just not convenient today, and that's really our big push.
But you're talking about solving problems that matter here, Pat. The biggest problem that's addressable globally using the knowledge and the technology that we have now is to bend the curve on unnecessary demand for healthcare services. Estimates of how much of the demand for healthcare is driven by health style and lifestyle choices, behavioral choices, ranges from 50 to 70%. Clearly, if you look at the ubiquity of cellular technology, the basically free data in the cloud, free analytics, it moves all kinds of diagnostic and knowledge-based services towards free, which is what has happened in other sectors. Add motivation, add ease of consumer access, as we were talking about, and you can begin to see how we may actually get ahead of this problem where we spend, in this country twice as much on healthcare as we should and have worse public health outcomes than the rest of the rich world.
How do you keep people engaged? How do you create the true social care network for them to stay engaged? And it's interesting to find out how different people are motivated by different things to keep them engaged, and that's part of what's necessary to start plugging into these apps, rather than it just being, a collector of information. How do you entertain and add the gamification, if you want a good word, into the app to keep them engaged, and then make the information matter, as I said earlier. How does that information, or can that information make a difference in their care, their world, their care networks world, things like that?
It starts with something very small and then advances, very large. So I don't know. Maybe we will really have drones that are delivering, medication someday. We'll definitely pilot that pretty carefully first, though.
You have to unpilot the drone delivery model.
It's nice to close with some humor. So I really want to thank everybody. This has been a great conversation.